So when I think of manual therapy, we think of our joint mobilizations, grade 1 through 5, soft tissue mobilizations, but there's also what I came across a few times was neurodynamic mobilizations. Can you kind of explain a little bit more in depth what that is?
Absolutely. And I use these quite frequently in my daily treatments. But a neurodynamic mobilization is pretty much a force on a peripheral nervous system. You're trying to inhibit pain or actually make something better based on moving the nerves, because we understand nerves move independently of other muscle tissue. So we could glide the nerve, we could tension the nerve, we could cause excursion of that nerve, and we know that in terms of pain processing that nerves carry important information to muscles, and they also have an ability to become sensitive. And nerves need space, they need blood flow, and they need movement. So a neurodynamic mobilization is a force imparted on the peripheral nervous system to have an effect such as inhibiting pain or improving motion.
So how are you explaining to your patients what you're doing with these glides and tensioning?
So as a whole, the way I explain manual therapy in general to my patients is a very blanket statement. We need to impart some movement, some mechanical movement. So when we're doing any type of manual therapy, whether it's a nerve-based treatment, if it's a joint-based treatment or muscle-based treatment, there is clearly a mechanical force and this biomechanical force that is imparted on the patient. But the effects of what we do tend to be more neurologically driven. There tends to be more transient neurological changes, no matter really what we're doing in particular. So I would explain that what I'm doing is imparting a force to, or imparting a motion to a specific nerve or muscle, and that's causing transient neurological changes that may inhibit pain or facilitate the muscle to relax. But then there's other non-specific effects that occur to someone's pain, where it could be their expectation and the environment, and actually my expectation on if something would work and how I deliver that message to the patient to have an effect or have a pain relieving outcome. So it's more of a blanket statement rather than discussing the individual nerve that I'm moving or the individual joint or the individual muscle tissue that I'm trying to mobilize.